This month is dedicated to highlighting colorectal cancer prevention and, of course, early detection. I'm Hartford HealthCare's Tina Verona. I'm so glad to have you join us on Connect to Healthier Live with the Hartford Current. And today I have the absolute pleasure of being joined by Dr. Osama Siddique. He's a gastroenterologist with CTGI at Hartford HealthCare. Thank you so much for being with us.
Of course.
We
Thank you for
appreciate it. Yeah, and of course, we invite you to be part of this very important discussion by asking your questions in the chat, which we're already getting folks asking questions. It's a popular topic. We're going to get right to it. Ted in Middlefield asks, I have heard of other options besides a colonoscopy. Can you describe the benefits and risks for them? That's an important question. Thanks, Ted.
Amazing question, Ted. Yes, there are a few options other than colonoscopy. They are either stool-based or based on direct viewing. Stool-based testing, they're great for screening, but they're not as sensitive when compared to a direct visualization, such as a colonoscopy or a CT colonography. The pro about the stool testing is, you can do it from home. It doesn't require a lot of, going back and forth and prep, etc. The con is, it's good sensitive test for colorectal cancer, but there are precancerous polyps that can be missed at times with these testings. So then we move on to the direct viewing, which is the colonoscopy or CT colonography. The con is, taking a prep for both these procedures and, spending time to come in and getting anesthesia, etc. The pro is, you get the diagnostic test right away with the CT colonography. The negative is it can also miss early polyps and smaller polyps. The good part about colonoscopy is you get the colonoscopy, we detect it, we detect cancer, we can biopsy it, or if it's early polyp, we can take it out altogether. So it's very sensitive. It's the most sensitive test out there compared to all of the testing, and that's what we recommend.
And sometimes, the at-home testing could lead to false negative, false positive, which would still require you to have a colonoscopy in the office.
Absolutely.
Yep.
So the sensitivity, as I said, is good, but the specificity cannot be as good, meaning there can be false positive, which will drive you towards a colonoscopy and other testing, and again, a whole new start from the beginning. Yep.
All right, from Middlefield all the way to Farmington, Mark asks, I have an upcoming colonoscopy. What can I expect from the prep? Anything I should be prepared for? This is a question that comes up so often.
Yeah.
And thanks, Mark, and good luck with that colonoscopy.
It does come up often, and Mark, thank you again. Great question, because it does weigh a lot on our patient's mind, that what will the prep mean? How many times will I go to the bathroom? What, etc. I would like to start off. You can always Google CTGI colonoscopy prep. It'll drive you to a link where we talk about all the different kind of preps, liquids, tablets, etc. The usual recommendation is at least 30 hours of a liquid diet prior to the procedure, taking that day, half day off maybe, the day prior to it. The usual liquid prep would be, starting around at 6 o'clock in the afternoon, and we split doses because that's what's shown to be the best outcome with giving us a clean prep. And then taking the next half at least 4 to 6 hours before the procedure. There is a tablet form and there's liquid form. I personally prefer the liquid form. It has a better kind of outcome with better clean out. And other than that, once you've cleaned out, obviously somebody brings you into the procedure. We put you to sleep, do the procedure, and wake up. And the best part about it would be the procedure itself, to be honest. Once you're done with the prep.
The prep has gotten a lot better over the years.
Absolutely. It used to be, it still is, there's 4 liters or a gallon, but now it's cut down to less than half, like 1.5 liters if you go with the liquid route. And then, as I said, there is the tablet form where people cannot tolerate the liquid prep, and the tablet works great for them as well.
In case you're just joining us, we're talking with Dr. Osama Siddique. He's with Connecticut GI. He's gastroenterologist at Connecticut GI, a part of Hartford HealthCare. We have another question coming in, this time from Glastonbury, and where we find Wendy. And she asks, if polyps are found during a colonoscopy, what are the next steps and treatments? That's such an important question, Wendy, and thank you for asking that.
Right, absolutely. Excellent question. Very important, Wendy, the question. So if we find a polyp during a colonoscopy, it depends on how big the polyp is, right? So if the polyps are usually less than a centimeter, we call them a smaller polyp. Most of the time we can remove it at the same time, and that's what's great about a colonoscopy. As I said, you do the test, you see something, you take it out. So it's a diagnostic and a therapeutic test at the same time, and it gets covered. There are polyps that are bigger, obviously, which can go up to 4, 5, 6 centimeters as well. In those cases, if we see a polyp like that in the colon, we tend to not take it out at the same time, because taking them out at an outpatient facility could lead to a higher risk and complication, and it can lead to recurrence of the polyp as well. So in the past few years, we've started to offer patients within Hartford HealthCare, and Hartford being one of the few centers out in the US which is offering these things. It is called a colonoscopy with ESD, or endoscopic submucosal dissection, where patients who have larger polyps, mostly around 2 centimeters or higher, in any part of the colon, we've started to take these polyps out via a colonoscopy, a similar procedure that you've already had and prepped for, but we take it out in one piece. It's like a microsurgical dissection. In the past, years ago,
you wouldn't be able to do that.
We wouldn't be able to do that. You would get a surgery. Surgery is still a possibility with large polyps, complicated, etc. But there is an avenue for our patients who have large polyps, or even early cancers that are superficial, that we can take out via colonoscopy at Hartford.
Yeah, that's incredible, because that would be a whole separate surgical procedure in the past, which is a big deal.
And the recovery time, etc. You walk away,
it's a whole host of
you wake up, you go home right after the procedure.
Yeah, it's incredible. Can certain polyps turn cancerous? That's always a question.
Yes, there are some features within the colonoscopy that we can look at right after or during the procedure that can tell us if the polyps are already cancerous, or if I have a higher risk of cancer. Usually, the polyps are larger, there is a higher risk associated with it. There are features on the colonoscopy with different white light imaging and NBI imaging that we can tell, oh, this can turn into a cancer. And obviously, when we take polyps out, there are certain type of polyps, like we call tubulovillous adenomas, or TVAs, that can have a higher risk of cancer, and that's when we start recommending a more closer surveillance, and also to the family members as well.
All right, all the way to Suffield, where we find Edward. He asks, how long does a colonoscopy usually take? Is there anything I need to do after the procedure, except maybe eat, right?
Exactly. So
thanks,
again,
Edward, for the question.
Edward, great question. Yes, the procedure on its own usually takes around 20 to 30 minutes. And it's all, as I said, underdone under anesthesia, so you're going to be completely asleep. Once you're done with the procedure, we usually kind of take you to the post-op area, where there are nurses, we're checking vital signs, etc. For around 20 to 30 minutes, you'll be completely awake. There is some expected amount of gas, because we are putting some air to kind of visualize the colon, distend it, take look at it behind the folds, behind every kind of nook and cranny, making sure we're not missing anything. And once you've kind of cleared out the gas, which you should as soon as you wake up, you can go home. You shouldn't drive right after the procedure that day. Should take a day off, and also kind of not sign any legal paperwork that day. And diet-wise, you can go right back to the diet that you're on. Try to not go too much into it. Not have a whole rack of ribs and a couple of burgers, but you can slowly restart the same diet that you were on.
Yeah, because it is a big adjustment, right? You're cleaning yourself out, and then you need to kind of gradually get back into it.
Exactly. Yeah.
All right, Nancy in Bristol asks, how often do I need to test or have a colonoscopy procedure? This is such an important question, Nancy, and thank you for raising that, because sometimes you hear 5 years, 10 years, but then that could have something to do with your family history or whether you're a cancer patient yourself, right? Would that change the timing of how often you would have to get screened?
Correct, Nancy. Great question as well. Yeah,
thank you for that.
Yes, so it all depends on your history, your personal history, and your family history. So, if you've had a family history of a first-degree relative, which is your siblings or your parents or your children, having a colon cancer before the age of 60, you might be getting a colonoscopy every 5 years. If you also have two first-degree family relatives, again, siblings, parents, children, at any age that they were diagnosed, but there were two of them, then you again would be at a 5-year surveillance. And this is when you don't have a personal history of polyps. Now it all changes once you start on your own and you start having polyps or have a history of colon cancer. Obviously, with the history of colon cancer, it's much more rigorous. We do a 1 year, 3 years, and a 5-year surveillance, and then a 5 years forever. If you have a polyp, which is kind of in the small range, maybe less than 10, and you have had 1 or 2, the guidelines have recently changed. They say to repeat it in 7 to 10 years. Mm-hmm. If the polyps are between 3 to 5, then you're in the 3 to 5 year range, and then if you have more than 4 polyps, then it's a 3-year repeat. Mm-hmm. But then after the 3 years, you go back to 5 years. Again, a lot of numbers.
Yeah. Your
gastroenterologist, after the procedure, will come talk to you. They'll discuss the colonoscopy, tell you how big the polyps were, and what the expected surveillance protocol will be.
And obviously with this cancer and with all cancers, early detection is key. So we can't stress it enough that getting screening colonoscopies with a gastroenterologist do save lives. Absolutely. It really does make a difference.
Absolutely.
Yeah. Thank you for joining us. We really appreciate it. It's just so important, not just this month as we highlight Colon Cancer Awareness Month, but really all year round because in most cases, the symptoms do not present themselves.
They do not. Yeah, that's another important point. Mm-hmm. Colon cancer is the third, leading cause of death from cancer, and it is growing and at a faster pace in the younger population. And majority of the time, there are no symptoms. There is no pain. There's nothing. So, if you get this and you've read it somewhere, we want you to get in touch with us and start the screening surveillance protocol.
Yeah, and one thing I do want to mention before we close, it's so important. If you are diagnosed with colon cancer, the multidisciplinary team that we have in place at Hartford HealthCare is so incredibly vital. You have a team of specialists, you have nurse navigators, you have people that are with you every step of the way throughout the entire process that I think is really vital to highlight here.
Absolutely, yeah. We have a very strongly knit close care between all our nurses, the gastroenterologists, the surgeons, the oncologists. So as soon as somebody even finds a polyp or a cancer, the ball starts rolling. Yeah. You get calls, you get fit into schedules, people make time for people around. So yes, absolutely, the care provided by Hartford HealthCare and CTGI will get you in at the right time and get you the right care.
Dr. Siddique, thank you for all of this very important life-saving, really, information. We appreciate it. And thank you, as always, for joining. And if you'd like more information, just simply visit hartfordhealthcare.org/colon. I'm Hartford HealthCare's Tina Barona. Thanks so much for watching. We hope you got something out of this discussion. And remember to get that screening for that colonoscopy if you need to. We'll see you next time, right here next month. But for now, be well.